Hi, welcome to the Building for Societal Resilience panel at the Microsoft Research Summit. My name is Karen Easterbrook, and I'm a Senior Principal Program Manager in the Security and Cryptography team working on societal resilience. I've been working on vaccine records and other security topics. In this panel, we'll be discussing our experiences building for societal resilience. We've all been working on different projects in different capacities, many of them having something to do with pandemic response. We'll discuss our observations, the things we've learned, what's working, and what we see as the open problems. And now I'd like to invite my colleagues here to introduce themselves, starting with Christian.
Hello, my name is Christian Paquin. I'm a principal program manager in the MSR Security and Cryptography group. I'm essentially by trade a cryptographic engineer working on identity and privacy enhancing technologies.
Katherine?
Hi, I'm Katherine Lowe. I'm currently a master's student at the Oxford Internet Institute in the University of Oxford. Last summer, I worked with Microsoft Research New England as a research intern.
And Josh?
I'm Josh Mandel. I'm a physician and software engineer, and I run a small team at Microsoft that's focused on our work with the health data standards community, particularly for consumer access.
And Nathan?
Hi, everyone. My name is Nathan Evans, and I'm a principal software architect at Microsoft Research in the Societal Resilience Group. And my main focus is really managing a team of engineers to build across our whole project portfolio, and then think really broadly about how those projects connect and can find reusable solutions for the problems we face.
Great. So to kick things off, I'd like to ask each of you to talk a little bit about the projects you've been working on so that we can kind of introduce those to folks and start calling out some of the things that you've learned and observed in the process. Nathan, do you want to start us off?
Sure. Yeah, I'll start by talking about really the first project that we built after launching the team, and this was a COVID vaccine eligibility bot. And if you recall, at the beginning of 2021, eligibility was really the primary way that the vaccine was rolled out because supplies were limited. And so the idea was to do a phased rollout based on eligibility criteria, starting with things like age and other conditions that might make you more vulnerable to COVID. And the downside to this approach was that it was done state by state, which led to a lot of confusion for the populace. People weren't sure when they were going to be eligible, if they were eligible, if their particular medical situation made them eligible. And so we recognized that we had an opportunity to come in and help unify that information environment and help people find their eligibility much more rapidly versus trying to search around and find and just kind of cast about on the web. So what we did was we built a bot, and the idea of this bot was that it would unify that data across all of the states and jurisdictions that were involved. This included individual states, oftentimes counties and cities. And the goal was to provide them with a bot that would give it a conversational back and forth interface. So in other words, you'd come in and the bot would say, where do you live? And then it would use that to look up the exact information required to help you understand your eligibility at that time. And the kind of interesting thing about this is that we recognized that this bot would help us to solve a very acute problem right now, today, helping us towards this goal of societal resilience. How do we help people get vaccinated quickly and find out their eligibility? But we also knew that it had a very limited timeline. We knew that, as the vaccine supply got better, that eligibility question would no longer matter. It would mostly be about just where do I go to get my shot, right? How do I get an appointment? But what was interesting is that we built this with principles we think are enduring beyond just that short window of usability for this particular bot. We know that during a time of crisis, the information environment is often very confusing. It's fragmented. Disasters don't really care about boundaries and borders. And so oftentimes it's very geo-specific. And so we built on these ideas of, federating together information sources and making them accessible to people in a conversational, intelligent interface. And now we have a framework. The next time we have a crisis that involves this kind of information environment, we can deploy it much more rapidly. So we've built ourselves some tooling to take us the next step.
Thank you very much. I want to go next to Katherine. Can you tell us a little bit about the work that you've done with us and some of what you've observed?
Of course. I was one of the qualitative researchers on the Project Resolve team. As you may or may not have heard during the last panel, over the past year, Microsoft Research built a team of qualitative researchers, designers, and engineers to collaborate with community-based organizations, we call them CBOs for short, and community health workers, or CHWs for short. These are your local nonprofits. The ones that we were working with were primarily in majority minority communities, and they may have anywhere from 1 to many employees. Most of the people working for them are CHWs and are providing all kinds of services, such as food boxes, trying to help someone find housing or find a job, and more recently, vaccine clinics. Together with our engineering design teams and CBOs, we're building a software tool for community health. Our team conducted close to 30 interviews and co-design sessions across 14 CBOs and have been liaising really closely with the product and engineering teams. While Microsoft is supporting the project, as much as possible, the software and the development is led and owned by the CBOs themselves. And that last part is honestly the most important part of Project Resolve. In our team's interviews with these community health workers, they were astonished that we were even talking to them, let alone asking them to help drive the development of the software. They told us that they're used to people saying, here, use this software, without ever asking for their input. And thus, the technology that they're given often doesn't really work well for them. More broadly, technology is a powerful tool that can empower. But there are many organizations and communities, usually those that are already under-resourced, that aren't being designed for. And as we heard, sometimes it is even worse when people who aren't from those organizations and communities, who don't look like them, don't know their work and don't know their challenges, try to design software for them with false assumptions. To build technology for society, we need to truly design technology with diverse communities, not just those that are conveniently near engineering teams. And that's what's at the core of what we're aspiring to with Project Resolve.
That's fantastic. I know that build with and not for has been one of our mantras that we've been working to, and I'm not sure that we're there yet, but I think it's an important aspiration. Josh, I want to go to you, and can you tell us about smart health cards and some of what you've learned along the way?
Sure. So I've been involved in a couple of projects related to the pandemic response, particularly around data access. So one of these, the Smart Health Cards project, is really focused on giving individual consumers a record of the vaccinations that they've had and putting that together in a standardized format so that they can save it and share it downstream when they want to demonstrate which vaccines they've had. And this has been a project that was very interesting from the standards perspective, because we had a number of the foundational standards that we needed for this already in place, but also some gaps. So in the US, we have this kind of health IT infrastructure where individual consumers can get access to their healthcare data from healthcare providers. There's a whole system of APIs and patient portals, and there's connectivity so that you can take an app like the Common Health app on Android or the Apple Health Records app on an iPhone and connect those to a healthcare provider. And that's one of the common bases that we had to build on. But we also knew that we were missing some pieces, particularly around the privacy story there. So we had good ways to give consumers a copy of their information. But if we wanted to let consumers share those data downstream in a safe way and in a tamper-proof way, that's where we were missing some pieces. So maybe some of the lessons that we learned along the way were really focused on bringing together a diverse set of perspectives to help us work through how to fill in those missing pieces. So working with healthcare providers, with pharmacies, with labs, with software vendors that build healthcare record software, working with public health, working with some of the consumer health organizations, technology companies. There was a big mix of organizations, all of which had a part to play. And traditionally, this kind of coordination happens through a standards development framework. It's a very effective way to bring all those parties together and work through these details. The challenge is that that traditional process is very slow. and so slow really that it's unsuitable for making quick decisions and rapidly evolving these kinds of technologies in the context of the pandemic response. So we had a very interesting time figuring out how we could do work out in the open, develop consensus by bringing together folks who were writing code and trying things out, and then also feeding this work into a standards process, even though we knew that process was going to take more time. So those are a couple themes that I'd love to dig into more if we've got a chance on this panel. But maybe just to sum up at this stage, I'll say building consensus is one of the most challenging things. But getting to the stage where we have well-supported open standards is also a superpower from the resilience perspective, because that gives us a building block that the whole ecosystem can start to use.
Great. And Christian, we've also been working on smart health cards. Do you want to describe what you've been doing and what you've seen?
Yeah. So in response to the pandemic, our team came and helped with the project that Josh discussed, specifically smart health cards, and we came in with a kind of a security mindset, being a cryptography team, saying, okay, what can we help? Because there are things we can propose, and we did some at the beginning some security reviews and proposed some simplification to the spec, because as Josh mentioned, the timing was very important. It was a quite urgent problem, and then we realized that a lot of our ideas were mostly was going to be roadmap work. That's no time to do and build all sorts of these things and get agreement and consensus. So the work has been what could we do to accelerate the development and the adoption of these smart health cards. And just to kind of give an idea what these are, essentially is the electronic equivalent to your CDC paper cards, as a one subset of what this thing can do, and how can you present that in a way that's verifiable, that you make sure hasn't been forged, hasn't been modified, that the issuer is trusted. So there are a lot of issues, and comparing to other identity projects where these type of credentials can be created, this project kind of focused with the pandemic pressure to get a consensus and some things working. There was a lot of discussion with all sorts of stakeholders across different companies to get something that works, that's practical. And to help with that, our team, we built some development tools to allow implementers to validate their artifacts, their implementation, because it's very easy. Like nobody was an expert in everything, from the medical fire profile, medical data encoded into these JSON web token, which is another area of expertise, and then encoded in QR codes that, I think everyone learned something that they didn't know about. So implementing the full range of the spec was kind of challenging, and our tool helped debug these things and maybe save weeks of development to everybody who implemented that. And to the point that the VCI, which is this, I don't know what's the latest official acronym of this organization, the verifiable clinical information, I think that's one of the later one I've seen, is a group that oversees what's valid smart health cards, and then they made our tool mandatory to use to be listed as a trusted issuer. So there was a lot of interesting things that we can talk a bit more in more details later.
That sounds great. So one of the first things I wanted to dig into was that how we've gone about these projects has been different from traditional research projects and traditional software projects, and intentionally so. Nathan, do you want to talk a little bit about that?
Yeah, I'll start with a little bit of kind of the traditional software engineering. When we talk about engineering, we think a lot about building software products, right? And that involves ways that we do project management, that involves code control, bug tracking, and really getting into the design of products and how how we build interfaces for people to use, et cetera. There are a lot of those things that we do still do here that are similar, because they're valuable processes that work. But really, most software development isn't aimed at solving problems for like nonprofits with tight budgets. working in complex care situations. So I'd love to hear Catherine's perspective on how we've sort of gone beyond typical ways of thinking about design and thinking about the way we build these things for these sort of new scenarios and new audiences.
Katherine?
Yes, of course. Thank you, Nathan. I think one thing that I really want to talk about is what we think about user research and how we built on user research. Typically in a software project, in a software product or in software development, product managers do conduct user research. But mostly that might just mean putting some screens in front of some customers, whether that's the people who are actually going to be using the product or just people that are available, people that the engineers and the product teams can find. At Project Resolve, yes, we're interviewing CHWs, and at times we are showing them screens and asking for their feedback, but we're doing a lot more than that. Instead, our research team is really borrowing from our social science training and qualitative methods. We're asking questions, yes, about the tech, but not just about the tech. We're also asking questions about the power structures and relationships in the community health space. In addition, some of my personal research over the last summer has involved thinking about new ways of collectively organizing autonomous organizations around technology, borrowing from cooperative movements. And let me make this all a little bit more concrete. What we learned is that in the community health world, power is very concentrated in large health systems, governments of all levels, and other funders. This power dynamic directly results in the technology that CBOs use. Often, CBOs have to balance many mandated data portals that don't really allow the CBOs themselves to retain their own data in a useful way. For example, let's say CBOs go and organize and do a vaccine clinic where they vaccinate people. They might collect information at that event on paper forms, and then at night in their offices or in their homes, they'll type out that information in the paper forms into a state data portal or something like that. But all of this data that goes to the state, the CBOs don't really see after they entered it into the portals, and what they're left with, which is a stack of papers that's really hard to wrangle. And now, to be clear, technology itself can't solve social problems or rebalance power in favor of CBOs, but they can help create new relationships that help and empower those things. How we're doing this in Project Resolve is building a tool that gives CBOs a home for their data, and eventually, we hope that the tool will allow CBOs to tell their story. Together with CBOs, we imagine a future where CBOs are able to sit at the table where policy and funding decisions are made, because they can show that they have the most complete data and picture of what's going on in their community, what they need, and why preventative care and addressing the social determinants of health is important and cost-effective. Thinking back to this vaccine clinic example, what if instead of just giving over the data that the CBOs have to the state, they can put it into their own software and be able to run advanced data analytics and be able to have more control over their own data. That way, they have a way of talking to funders and talking to governments about what they're seeing on the ground and what they know are happening, but just right now don't have the evidence to back it up. And these learnings about what we could do with the technology, how the current relationships exist, and how might we improve upon these relationships wouldn't be possible in a traditional software development process with traditional user research. It's really these deeper conversations and leadership from within the CBOs that have made these things possible.
Yeah, and to circle that back a little bit for building the software, we have to take that input, and it becomes sort of a balancing act where we recognize the realities of cost to engineer things. So that kind of input from these CBOs, that kind of deep partnership, has to feed into our technology choices. It has to feed into how we think about the platforms we choose, because those they have costs, they have flexibility limitations sometimes. So we need to be making technical choices that actually support those, while also sometimes negotiating a little bit on what we can and can't do because of things like cost. One of the kind of key areas that we tend to bump up again is this idea that One of our core principles is to release software open source, right? We believe that releasing this code for others to use is a valuable thing for the community. But what we often forget is when we release these technologies and we release these platforms, they may not be actually usable by the organizations we're trying to work with because they might not have a developer on staff that can deploy it. They might not have IT staff. And so we really have to rethink how we manage that. You know, even the idea of open source, for all intents and purposes, may well be closed source to somebody who doesn't have the right resources to actually use it and go with it. So all of this kind of factors into this, you know, this balancing act of understanding what's necessary, what's optimal versus what we can achieve, and how we prioritize the things we build.
Thank you both. That was really cool. I want to jump over to smart health cards and maybe start with Josh. One of my observations has been that the clarity of focus, Josh, that you have on smart health cards has helped kept that project on track. I guess, you know, when you think back to how all of that work started at the very beginning of the pandemic, what are some of the key points and the key things that stand out to you as to, you know, why this is working so far?
Yeah, so I'll say when some of these questions first came up early in the pandemic response, you know, these were the days before vaccines were available. We didn't know whether vaccines would be available within any reasonable time frame. But already we had some similar questions around lab tests and lab results. If I have a negative PCR result on a Tuesday afternoon, what does that mean? How long is it good for? How do I share that with somebody? How can that person make sure I haven't just forged that result, you know, in Photoshop? So many of these same kinds of questions we're asking today about vaccines, we started asking over a year ago around lab results. And we realized that the answers were changing very quickly. Our knowledge, sort of science and predictive public health information was evolving very rapidly. And so building a system that was going to be useful in that context, we had to step back and say, well, what are the things that we can kind of rely on even as some of the science and the recommendations and the policies change? And what we settled on was to focus on sharing, you know, what I colloquially describe as kind of immutable clinical information. I had this test done on this date, and here's what was measured. It doesn't always go as far as what people would like, which is kind of an interpretation or a conclusion. If you're going to decide whether to let somebody back into your office building or on an airplane or into your country, you really want a high-level conclusion like, yes, this person satisfies all the conditions required by a certain policy. But gosh, those policies were changing really fast. So one of the things we did in terms of focus was to say we were going to focus the Smart Health Cards effort entirely on the verifiable clinical information and allow a whole ecosystem of different downstream tools to be developed to help interpret those clinical data in the context of policies, to draw conclusions and decide, what the policy said in terms of who was allowed to do what. So that was one example of a really strong focusing decision that we made early on. But I would maybe highlight a couple other tensions that we've discovered along the way. We tried to stay true to that original focus. So one is trying to pick the right kind of model for sharing the right kind of data. And for consumer access to immunizations, this is health data, fundamentally. These are your vaccine results or your lab results. You should be in charge of deciding how to share them and when. And if you choose to share these data, that should be a decision between you and whoever you share them with. So we wanted to provide the right kind of privacy infrastructure to make sure that, for example, the state public health portal that gave you your records wouldn't have to be part of the conversation downstream when you decided to share those records on with somebody else, so that you could have the expectation that you were making that decision in private. But for other projects, as part of the pandemic response, totally different evaluation. So just to give a quick example, outside of smart health cards, we've done standardization work with the major pharmacies around COVID vaccine appointments. So how do I figure out when there's an appointment available at my local Walgreens or Kroger, and so on down the list. And so we worked on open data standards to say, here's how you can publish a list of all the appointments you've got for the coming week or two. And there was a lot of hand-wringing there because historically, pharmacies made these scheduling data available as part of their own API. They made it available to their own partners in the context of data use agreements that they set up. But in the pandemic response, we realized that a shift was going to be really important to say, you know what, these data are part of an overall public health response and posture. And there's nothing sensitive about knowing that my local Walgreens has a 2 p.m. appointment slot available that I could book right now. And so we were able to shift both the mindset and the technical practices there to publishing open data sets that anybody could access for those kinds of appointment data. So picking the right data model and the right sharing model for those data has been a huge part of kind of not just picking the problems, but starting to outline the solution space. And then maybe one more tension that I'll mention has been around kind of the flexibility of some of this work. So early on, when we first started trying to figure out how we would give consumers a copy of these data, we outlined a whole bunch of different formats for making those data available. They were all based on the same clinical data models, so all packaging up the same information. But one of them was, okay, you can download a QR code or print a QR code on paper. Another was you could download a file that you could store in your file management program on your computer. Another was you could allow an app to request data from another app, directly using on-device APIs. So we tried to define a whole bunch of different ways for moving these data around, because honestly, we weren't sure which of them would catch on, which of them would be the most important. And it has turned out that QR codes have been a really strong common denominator, to the point where most of the other options we've made available for sharing these data aren't being used, or at least aren't being used widely. And that kind of focus often comes from trying a bunch of things and seeing what the market picks up, or seeing where the interest is. It can be difficult to predict ahead of time, even if after the fact that seems kind of obvious. But the truth is, a year ago, we didn't know it was going to play out this way. So early decisions can provide flexibility, but at the same time, those early decisions can really stick around for a long time. You might make a choice that you think is temporary, but as soon as that gets deployed across multiple organizations in real life, now that's a decision you're committed to. So balancing those tensions has been kind of the name of the game here.
Balancing tensions has been a theme that has come up again and again and again in this work. And Christian, I want to sort of throw to you next. Can you talk a little bit about some of your experiences in sort of doing this work under the time stress and general stress of a pandemic and a lot of politicization of some of the work? How has that driven different considerations in what you do?
Yeah, I guess too, as follow up to what Josh was saying, there were a lot of technical tensions and decisions we had to make in the standard. I mean, ignoring the political tension, because vaccine credentials are very central, or vaccine themselves and credentials for sure. Everybody has an opinion on them and the credentials, but having made the decision that this is an important thing to build and do, then what to actually support. There were a lot of things. As I mentioned at the beginning, we came in with a lot of ideas with cool crypto techniques to provide minimal disclosure capabilities. We can imagine you have a strong health record and be able to prove on to a relying party, to a verifier, responding to a dynamic policy you don't know, any type of things. You can make proof that, I received vaccines, the vaccines on your list within the time frame that I'm considered fully vaccinated, without disclosing the dates at which that you can also very interesting proof intervals of dates. But that's very ahead. And having observed what happened with the contact tracing apps, for example, where there was a lot of very advanced techniques, crypto techniques that have been built, for example, by Apple and Google and all other sorts of competing proposals. A lot of things have been built but didn't end up being used in real life so much. So we wanted to avoid these pitfalls. So what became clear is that we needed something that's simple, easy to build, easy to deploy. And that's kind of where we landed. And that QR code, as Josh mentioned, which kind of is the emerging best way to share this data. It's not a URL like you typically see. These QR codes are 99% just encoding a URL, but it can encode anything. So for us, it is a signed piece of the clinical data. So the crypto signature takes a big budget of that QR code already. So then what you're left with kind of, and that was kind of, okay, we need to be, it's going to be bigger than that. And then a lot of decisions ended up being due to this space limitation. And it forced us, and being in the pandemic and the urgency of having that, because people were starting to show paper credentials all over. So it's like, it needs to happen now. So we reach an equilibrium of what was needed and in there. And also, so that's the QR code itself, or the content. Another aspect was, okay, who are the trusted issuers? Because anybody could just in some countries, like in Israel or in Canada, where surprisingly my native Quebec province, it's the accent there. So they were the first to issue smart health cards. They saw the framework. They did not reach out to the organization. They just started to issue these to our pleasant surprise. And now in Canada, 75% of Canadians have access to a smart health card, so that's kind of fantastic. But over there, because of the health system, is very centralized, so each province can control who can issue. I mean, in fact, it's state issuance. In the United States, it looks completely different. There are all sorts of private pharmacies, state registries, hospitals that are the source of the information, and we need to have ways, and we've built things to validate who are the trusted issuers, to make sure there's a trusted list, and you can also tie that to a conventional PKI to establish trust. So the framework itself is very versatile, and found a way that simply works. And just seeing the success of deployments proves that some of these decisions were right.
Excellent. You mentioned sort of the importance of both flexibility and simplicity, and I know, Katherine, that those are themes that you've talked about as well. Do you want to dig into that a little more?
Yeah, of course, Karen. I think what Christian and Josh talked about really highlights the importance of those two things, simplicity and flexibility. And of course, those things are important in building software more generally, but especially for building software for society. Because we don't only need to build software for one type of customer, maybe a customer that has more resources, that has more time, and that has more technology and is used to more technology. But also for people that traditional software and traditional technology doesn't reach. We don't really have, we can't really just exclude people and say that they're not our target customers or not our target users. And I think that's what's really important about some of the work we're doing at Project Resolve 2 that's actually trying to reach these communities that technology doesn't usually reach, and something that Christian and Josh are thinking about too, and these smart health cards, and thinking about how paper and QR codes can really make this accessible to everyone.
One of the challenges that we've had with societal resilience more broadly has been problem selection, because there's just too many things that could be done, and how do we select and where we invest. Nathan, you've said it, I think, really well, that we need to find things that meet short-term needs and have longer-term uses. Do you want to talk a little more about that?
Yeah, sure. When you're working in the space of addressing crises, there's a lot of pressure to look around and find the current ones and dive in on them. And we do that. But at the same time, as a research team, thinking about Horizon 3, 5 years, 10 years, what is kind of future things that are going to affect humanity, we really have to keep the long view. And so one of the ways we've been thinking about this is that current crises are a place where we can contribute and we can make an impact. And we can also find patterns that we can then reuse long term. And really, it forces us to get our research out of the lab a bit. It puts us on the ground with current situations that people are in now, which is really an accelerator on the research itself. So it really is all about balance. We've talked about that a bunch, I think, today. Finding the right amount to engage with today's impact, while also thinking about, how does this principle or how does this technology apply for something we may face 5 or 10 years down the road?
And Josh, what do you think about this?
I mean, so I'll say this is a framework that for me really resonates, but also presents some challenges. So when we thought about how to set up an effort like smart health cards as part of a longer term vision around consumer access, for me, that's really motivating because it ties back to things that I've been working on for the last decade, right? How do we give people access to their health records that are not just complete, longitudinal, bring together data from many different sources, but also provide the ability to share those downstream in a safe and a trustworthy way? Like, that is a really important long-term vision. And being able to do that with one tiny slice of data, like a vaccine record or a test result, is a great incremental step toward that vision. But I will say at the same time, it can be dangerous to look at, sort of the crisis response as like, hey, how can I take something that is part of my long-term interest and use that as a lens for getting something done in the short term? Because sometimes it sort of tilts you towards solutions that are not the optimal short-term solutions, right? And so there's this balance that comes into play there, and it can be difficult to impartially make that assessment and say, I'm picking this not just because it aligns with my long-term vision, but also because it's the right thing in the short term. That can be hard.
Josh, I appreciate you sharing some solid examples. I'd love to actually circle this back to the COVID bot a little bit to give a very concrete example of how we thought about that from the engineering perspective. So we did have this, as I mentioned in the beginning, this opportunity for direct impact. But we were thinking about these long-term principles and how this would be useful. And I would put it in maybe 3 time buckets. I think the near-term bucket was deploying a bot that was useful for people today. The next thing we did is we open sourced all of the code and made it so that others could fork it and use it in their own jurisdictions or nations, so that in the next few months or years, as the eligibility question, for example, becomes something that expands globally, others can build upon that work. And then long term, we were establishing principles of, for example, we used GitHub as an open, transparent database. And so we were really thinking about how do we build information architectures that can accelerate and still apply for much future crises, like much further down the road. So thanks.
And then one other thing I want to bring up is that another recurring theme in these projects has been coalitions and the importance of finding partners, building coalitions, finding allies. And I'd just be interested in exploring that a little more. Josh, do you want to talk about that a little bit?
Sure. I mean, so from the health cards perspective, the organization Christian mentioned, VCI, has been instrumental in growing both interest and awareness and support for these emerging standards. And that's a group that now includes over 800 members member organizations who have registered and said that they support this work. But building that coalition also is a challenging thing to do, because the more different viewpoints that you bring in early into the conversation, the harder it can be to make a coherent judgment about which parts of the problem to solve, what kinds of approaches or techniques that we'll want to take. How do you listen to everybody and then come away with a conclusion? And I'll say that very early on in the project, even when we were having just kind of back channel conversations with 2 or 3 kind of organizations who were interested in this space, one of the principles that we took on was, first of all, have a demonstration ready from the very beginning. If we're writing any kind of spec or use case, let's have a demo that we can show very concretely to make it clear what we're talking about, so that we don't spend a lot of time kind of vaguely describing ideas. And that principle of having demos ready very quickly became, let's document everything that we're doing openly. So even if we're having kind of a private conversation about how we might want to build support for some new APIs and data formats, let's have a public spec, a public demonstration repository, public data sets and samples, so that even if we didn't have a formal consensus process, the work that we were doing was out in the open, and folks who are interested have a way of finding it and paying attention and then making themselves known. And so that allows more of a model where folks can come to the table if it's something that really motivates them. And so between that model and building out a more formal coalition in VCI over time, I've been honestly pretty surprised and impressed to see the speed with which we're getting adoption of this work.
And then I know that Project Resolve is really all about coalitions. Katherine, do you want to talk about that?
Sure. Yeah, as Josh mentioned, and also as Nathan mentioned a bit earlier, we're also thinking about a lot of the same questions as we're open sourcing our technology to try to think about what are the stakeholders who might want to contribute to the project. But we're also thinking about how can we use this technology to build new coalitions. All of the CBOs that we work with and I've interviewed, we consider partners. But right now, we're in the process of building a coalition among some of these CBOs. And some of the leaders of these CBOs in this new coalition spoke at the panel previous to this panel. Because as Nathan mentioned, even if we open source the code, these CBOs, they don't have IT departments, or at least a lot of them don't have IT departments and can't really set up the software. So we're thinking about how can we borrow from ideas from co-op movements, but around technology, and how can we organize CBOs to be able to use this tool as a lever to collectively organize and increase their power together. And we're still trying to figure it out and still trying to think about what we can do with it. But we're hoping that we're laying the foundation for this coalition work.
That's great. To wrap up, I want to ask one final question. I know that as we've been working through the societal resilience work, one of the things that has just been rocket fuel for me is how the field work that Katherine and others are doing is giving us more information to better understand how some of the work that we want to do in identity and cryptography can be better designed to actually reflect what people really want and to better reflect the world and the relationships that they're in and the institutions that they work with. And this is going to help us land things much better. I also think it's an open problem. We've talked about how to measure our success and how do you measure success of a societal resilience project. We've talked about what would a KPI be for a resilience project and how can we actually measure equity and whether we're achieving what we want there. So that's a couple that I see. I want to go around the table quickly and just to close, what open research problems, what open questions do you see? Starting with Nathan?
Sure. I think it comes back to sort of balance and adaptability and, not getting stuck with thinking about today's problems with today's solutions. I think we just need to keep our eyes on the fact that, we've got 5-year, 10-year, 20-year time horizons for some of these things. And the technology that we deploy in 10 years might be very different than today. And so how do we leave space for that where we don't get caught up in trying to think about today's mindset and today's tools, but really think where they can go next. So I think that speaks to kind of adaptability and again, finding that balance between solving a current crisis versus really thinking about the long future and how we become more resilient overall.
Christian?
Yeah, so I think what we've built kind of also sheds light on what we didn't build that was further down the line. And these type of projects kind of give us an alignment between what we think might be good and what we see use cases shaping up to be. Specifically, like the things that we ended up using in smart health cards. I remember some of these standards being built 10 years ago and this discussion. So we kind of know what we need to build now to get the new set of use cases ready, which provide even more power to the user in a user-centric distributed environment.
Thanks. We're wrapping up here. Josh, any quick words?
Yeah, I mean, from the KPIs perspective, smart health cards really lends itself to a few measurable things, like how many individuals can get access to a health card with their own data, how many actually do, how often are they shared in the context of some kind of verification scenario. So those are things that we're trying to figure out how to track as a community. But I'll say in terms of overall user research, this is really an open problem in the standards world because we're often 1 or 2 steps removed from those users. We define a spec, which is implemented by a software developer, which is deployed to customers, and understanding that whole chain is still really an open problem for standards.
Perfect. And Katherine, you get the last word from the panelists.
Taking a bit of a step back from software development, having been in both traditional product and engineering roles and traditional social science research roles, I've seen that technologists are often divorced from social scientists. And I really hope that more social scientists are not only involved in tech research inside the academy, but also in building software, and particularly for society. I hoped we shared one way to overlap these fields, but I really hope to connect and hear about some of the other ways and ideas on how this overlap can be created.
Fantastic. Thank you, panelists, and thank you to people listening for your time. That wraps up this panel on building for societal resilience. Up next is a panel on monitoring for environmental equity. Thank you.
Thanks.